Good evening. Thank you for joining us. I'm Yoon Jung-min. We start with concerns growing over a medical crisis. Interns and residents at the nation's big hospitals tendered their resignations and are set to leave their workplaces en masse starting tomorrow. In fact, some have already done so. Our correspondent Choi Soo-hyung is at one of the hospitals where action by doctors is taking place. Soo-hyung, how is the situation there?
Good evening, Jung-min. The collective action by doctors, including resignation by residents, has potentially begun in earnest, and concerns about the medical crisis are growing together. I'm now in front of the Severance Hospital located in Sinchon, Seoul, where some residents have stopped their working starting today against the government's plan to expand medical school quota by 2,000 per year. In the Severance Hospital, surgery schedules have already been adjusted, and the authorities here say the medical chaos that everyone worries about has not happened yet. This is in part due to emergency response systems after the doctors' action, such as reducing the operation of surgical rooms to 50 to 60% of normal capacity. This is one of the major teaching hospitals in the country, part of the so-called Big Five, along with Seoul National University and the Catholic University of Korea Seoul St. Mary's Hospitals and Seoul Asan and Samsung Medical Centers. Last week, the Korean Intern Residents Association announced that all residents at these hospitals and the other nationwide were scheduled to submit their resignations by Monday and will cease working after 6 a.m. on Tuesday. As of last Friday, 715 residents at 23 hospitals from across the country have submitted their resignations. However, none have been officially accepted so far. The number of trainee doctors at the Big Five is around 2,700, or over 20% of the total in Korea. They play a crucial role in emergency medical care, and should they proceed with their collective resignations, this will inevitably lead to significant gaps in patient care.
And Soo-hyung, what do the authorities have to say about this?
Currently, there's no change in the government's stance in its refusal to accept doctors' demand and calling their collective action intolerable. The Health Ministry has warned that it could revoke doctors' licenses if they do not comply with return-to-work orders. The government has issued the order to 103 doctors who have refused to work, with 3 of them failing to comply. Also, all efforts will be made to minimize inconvenience for patients. Prime Minister Han Duk-soo visited the National Medical Center today at around 3 p.m., inspecting on-site countermeasures. Han also held a meeting this morning to come up with measures to combat any collective action, including expanding telemedicine services.
To ensure patients face no difficulties in accessing medical facilities, we will fully allow non-contact medical consultations in case doctors walk off their jobs.
In addition, the Seoul Metropolitan Government is running emergency rooms at 4 municipal hospitals, Seoul and Borame Medical Centers, and Dongbu and Seonam hospitals, while extending the operating hours of public health centers in 25 districts until 8 p.m. on weekdays. That's all I have for now. Back to you, Jung-min.
That was our Choi Soo-hyung from Severance Hospital. Thank you.